We are here with Dr. Dani McVety. She's the creator of Lap of Love, which is the nation's leader in end-of-life care for pets and pet hospice. Not only that, but Dani, you were voted the pet industry's Woman of the Year last year. That is so impressive. Congratulations.
Thank you. Thank
So
you.
tell me a little bit about Lap of Love and what exactly this company is.
Yeah, exactly. I had no idea what Lap of Love was going to turn into. I started it 3 months out of veterinary school. I was doing emergency medicine at the time. And I found myself gravitating towards the end of life cases. I was good at them. I got a lot of personal fulfillment from helping people. If you ask any veterinarian, where they receive most of their thank you cards, it's from the euthanasias. It's where we get those thank yous, those heartfelt, really the heartfelt connections with people.
So you found that you were good at something that a lot of people maybe like to avoid or they don't like to talk about. I know no one is ever looking forward to it. But you were good at it, but it's not just because you're a brilliant veterinarian who's so, great with obviously knowing what you need to know to be in such a top leader in your field in the sciences, but also because, at least in my opinion and from knowing you, you're also so very good with people. You're very good at understanding the human element of pet ownership. And what does that mean to you? Can you speak a little bit on that, how both of them kind of coincide with your job?
Yeah, no, thank you. And I always joke with my profession that the doors of a veterinary clinic are human-sized and they're not pet-sized. The pets come into the clinics attached to humans. And not only that, but the humans are the ones that communicate with us and tell us what's going on. And also, they're the ones that, at the end of the day, end up paying for the bill. And we have to have their buy-in in the treatment process that we're going to be going through in order to even make a difference in the pets' lives to begin with.
So you're thinking, how can I make something easier and better and more comfortable for a pet, whether it's end-of-life care or maybe leading up to something that may be considered end-of-life care, and simultaneously, how can I make that as pleasant and as comfortable and really as meaningful as possible for the person, for the pet parent, I think, as you say.
Yeah, absolutely. And I think it's upwards of 80 to 90% of us consider ourselves pet parents and not just owners, right, of these pets. But particularly when I was doing emergency medicine, I had the honor of helping people through a very, very difficult situation. And whether or not that was euthanasia or just a surgical issue, it was difficult for the family to get through. But I found a lot of, again, personal fulfillment and happiness and a lot of stability in helping people through that conversation, which is what led me to the idea of going into the home and bringing that toughest moment with your pet, the euthanasia, into a safe space, into somebody's home. And whether or not it was in the bed that literally the puppy was born into 15 years earlier. I've even met people on the beach or in the backyard or on a dock at sunset. I mean, it's beautiful.
That's so wonderful. I hadn't even considered the idea that it may not just be at home. It could be, maybe on their favorite hiking trail or something like that. That's so beautiful. So you don't not only just offered this service to them, there are several other doctors that you are connected with. How many doctors do you have right now working with Lap of Love?
Yep. So in the fall of 2009, when I started Lap of Love Veterinary Hospice, it was just me. It was me in Tampa, Florida. And then now, 9 years later, we have over 120 doctors that work with us around the country, helping almost 4,000 families a month.
4,000 a month.
Yeah.
That is so wonderful. I'm very impressed. Congratulations on those numbers alone.
Thank you.
And I'm sure it's just going to get even more and more popular because of all the benefits we just mentioned. So when I think of Lap of Love, I'm thinking on the lap. Someone's holding it. Is there a story behind that? Where did you get the name Lap of Love?
Oh my gosh, yes, absolutely. And I had no idea what I was going to call this service that I knew was kind of brewing in my mind. And then one day this woman came into the emergency clinic that I was working in, and she had her little dog wrapped in a blanket, a little Chihuahua wrapped in a gray blanket. I'll never forget it. And she looked at me and she said, "Can you just leave him on my lap? I just don't want him on that cold, sterile table. Can you leave him on my lap?" And I really think one of the most important traits about being a good doctor, a good business person, even a good human, is caring about what people want and caring enough to want to solve their problems and give them what they're asking for. And at that moment, I realized, I'm like, I would have asked the same thing if I were her. And I've been her since then. So for me to look at her at that moment and say, yeah, absolutely. So I went in the back, and that's not normal. It's not the normal thing that we're taught. We're taught to take them into the back, the treatment area, tape it in IV catheter, then bring them back into the room. But I didn't want to break that human-animal bond at that most important moment. So I just looked up a different way to give the medication, and I was able to euthanize her pet on her lap And she walked out of the clinic the exact same way she walked in, which is with her little dog wrapped in a blanket in her arms. And I thought that's what everybody deserves.
Oh, it's so beautiful. And what a beautiful tribute to that story, too, to name your company after that. I wonder if there is something, a reason why, I don't even know what I was going to say, so I was just filling time. Hold on. Oh, yeah? Good.
You got that, and now we're going to go to your
Okay.
wildlands.
Okay.
And
This is
you
to her.
Come with us.
Woohoo.
No, it's
Oh.
not.
Bye.
This is to.
Okay,
We're
so
doing this to directly to camera, correct? For wildlines or here? Where do you want it?
let's just see. I think she could do these to camera.
These aren't really lines, are they?
What are they?
I mean, this says talk about improvements, better now, clinic study.
Hang on a second.
Yeah.
Here, hang on a second. Let's see.
And you're, by the way, welcome to just yell lines at me, too. I can do that if that's easier.